Hey, what's going on, guys? Jomar Ferralis here, Doctor of Physical Therapy, owner of Ferralis Consulting and Physical Therapy. Tonight, I wanted to talk to you guys and present to you part 2 of how to do a PT evaluation in Spanish. But before I get into that, go ahead and hit the like and subscribe button below. And be sure to like, comment, and share. And feel free to follow me on my Instagram, Dr. Jomar _DBT7. All right. So part 2 is the next part of the 4-part series of how to do a PT evaluation in Spanish. If you haven't checked out part 1, go ahead and check it out on my YouTube channel. And now with part 2, the main things that I usually get into are checking vitals, checking strength, asking the patient some questions about their history, as well as if they're having pain, and performing standardized tests. All right. So when I do a PT evaluation, usually I like to gather some information from them, and I do work in home care. However, this information does apply really well to all settings, and you can kind of modify it as far as the questions go, whether you want to ask them or not. But some of the questions that I typically ask are, who lives with you? Okay, so that's an important question to ask, especially in home. You want to know if the patient has any caregivers that are available. So I typically ask, ¿Quién viva aquí? Okay, so that means who lives here. You can also say, ¿Quién viva aquí con usted? Okay, that means who lives here with you. That's just an easy question. They'll tell you, oh, I live with my family, con mi familia, or they'll say, no, I live alone. So you'll be able to gather that information from that question. And also, important question to ask if you are working in home health is if they have assistance from like a CNA or homemaker. So one of the ways that I go about it is I ask, ¿Tienes CNA or homemaker? Typically, even though CNA and homemaker aren't Spanish, Spanish-speaking patients will understand what you're talking about when it comes to a CNA or a homemaker. And so that is how I ask that question. ¿Tienes, meaning do you have? ¿Tienes CNA or homemaker? Okay. The next one is if they do, they say, sí, yo tengo CNA. The next follow-up question that I like to ask is how many hours they get. All right. And the reason I ask this is because it gives me an idea of how much help they need and whether you might need to order an occupational therapist, or if, you may need to tailor your goals to other things depending on if they have assistance or not. So then I ask, ¿Cuánto horas? That means how many hours? Okay. So if they have a CNA, they say yes. The next follow-up question would be, ¿Cuánto horas? Okay. After that, I like to just ask if they have any medical equipment. So the main ones that I usually ask are cane, walker, or shower chair. Those are the main ones that I have encountered in home care, and typically the ones that really only matter. So I do ask them, ¿Tienes bastón? Which is, do you have a cane? Or ¿Tienes andador? Which is, do you have a walker? And for shower chair, you can just simply say, ¿Tienes silla para la ducha? Do you have a chair for showering? They'll know exactly what you're talking about, and I never had any issues with that. Now, keep in mind, your Spanish does not have to be perfect at all. I am not a native Spanish speaker. I just happen to work with a lot of Spanish speaking patients and have gotten better over the years just through repetitive practice. And I'm sharing with you the exact script that I use to get these evaluations done quickly and to make sure that I collect all the necessary information that I actually need to complete the evaluation. So those are just a few introductory questions that I like to ask, especially pertaining to a home health PT evaluation. In outpatient, you could certainly ask these questions if you wanted to, but I think in home care, it's a little bit more applicable. So the next thing that I'll do is I'll typically check their vitals. All right, in home care, you're checking vitals every single visit. So what I say is voy a chequear tu vitales. Okay, that means I am going to check your vitals. Now, if you want to say I want to check your pressure, just say voy a chequear tu presión. I'm going to check your pressure. Or if you want to check their pulse and get the pulse ox on, you can just say voy a chequear tu pulso. So very easy, very simple things that tell the patient exactly what you're going to be doing. Next, I like to check the strength of their muscles, just as a general MMT check. So what I typically say with that is voy a chequear tu músculos. Okay, that just means I'm going to check your muscles, and it's super simple. And so when they're in a seated position or whatever position they are, you could just say levántalo tu pierna. So that just means lift up your leg, and then you can just visually demonstrate yourself, doing knee extension, and they'll follow you, and then you want to manually resist. So what you can say is no muevas. So that means don't move. And then when you go ahead and push, most of the time they will resist you, and you can get your MMT, you can get a general strength measure. If something is very significant, you'll be able to tell, but most of the time it's just part of the evaluation, and it's just a good way to check muscle strength, and it's super easy to do. Okay. The next one that I like to ask is ¿Tienes dolor?, which means do you have pain? That's a question I ask all the time. And so you're just asking ¿Tienes dolor? And they'll say, here, they'll start to point, they'll make hand gestures, or they'll say like in mi espalda, which is my back. And you just can go ahead and make a note of that. And if they have pain, the next follow-up question would be, how bad is it? So what you can say is, ¿Cuál número es tu dolor? So which number is your pain? So usually they'll understand what that means. However, if they're kind of having a little difficult time, you could just say a 0 a 10. So from 0 to 10, how bad is your pain? So that's how I go about asking about their pain. ¿Dónde es tu dolor? Where is it? And ¿Cuál número es tu dolor? What number is it? That way you get a general idea of how much pain they're in. And the final thing that I like to do for part 2 is a standardized measure. In home health, you're typically doing standardized measures more often. And these, I like to typically go with the tug and the 5 times sit to stand. These are the easiest to implement, whether or not a patient is Spanish speaking or not. But I've just found in my experience that these are the easiest to do when working with a Spanish speaking patient. If you happen to know more Spanish, you can go ahead and try other tests if you want. But in order to perform the evaluation in a timely manner, I like to do these tests because they're quick, they give you a good functional measurement, and the patient can easily understand what to do. The instructions are pretty easy. So with the tug, what I'll typically do is, before I even start talking about the tests I'll just say, yo tengo dos exámenes. So that means I have 2 tests for you. So yo tengo dos exámenes ahora, which means I have 2 tests for you now. And typically they'll know, okay, it's a test. It's a physical test of some type. So then you can just say, the first test is going to be the tug. And so you just say, el primero examen es, and then just say the name of the test, tug. Okay. And now to explain the tug, you just have them sit in the chair and you say, por este examen, for this test, caminas allá, which means walk over there, y de la vuelta, which means turn around, y siéntate en la silla otra vez. So that means you're going to walk over there, you're going to turn around, and you're going to sit back down. So, caminas allá, de vuelta, y siéntate en la silla. That's how I say it. I've never had a problem with a patient understanding the test. Typically, the tug is performed twice. So if they kind of mess up, you can just say otra vez, más rápido, por este vez. So that means for this time, do it a little faster, okay? Now, for the 5-time sit to stand, this is super easy, and that's why I like it, because it's super efficient, and it tells you how strong their legs are and gives you a baseline. So all you have to say is pararse y sentarse 5 veces, okay? You will stand up and sit down 5 times. Now, to kind of give them the idea that they have to do it as fast as they can, you can just say, pararse y sentarse por 5 veces para tiempo. So that means stand up and sit down 5 times for time. And then as they do the test, if you notice that they're not doing it as fast as they can, you can just say, sigue, 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 which means let's go, let's go, let's go. And that'll kind of give them the idea that they have to do it faster. Okay, so that is part 2 of how to do a PT evaluation. I hope you enjoyed this video and I hope you learned something. If you want, I'm including a link to the PT evaluation script in Spanish in the comments below. You can go ahead and download that for free. It's the exact template that I use in all my PT evaluation patients, and it outlines every single part that we will be going over in video. And so you can print it out, you can make notes on it if you want, but it's there for you. I hope you enjoyed this video. I will talk to you guys later.